and that was granted. So which means that it was just at the beginning of the pandemic where it was difficult for us to travel, but going forward, we were able to move freely and do our work. Because so sometimes if people are not allowing us to move or to enter any place, you might find that there are violation of human rights inside that particular place. That's what the government also take us serious when we say we cannot be restricted as the Human Rights Commission to move around, conducting inspection and also investigating allegation of human rights, allegation of violation of human rights. So, but now the biggest challenge was regarding the limitation of the rights. We all know that when we talk about the pandemic, the government has to limit the rights of our people. The right of the right to the freedom of movement was also limited. The issue of gathering, a freedom of association. There were so many rights that were affected by the restriction or by the regulation during the COVID-19 pandemic, right at the beginning. So you will also understand that each and every level of the lockdown come up with certain restrictions that has to just go directly and limit the particular right. Then the challenge that we faced initially was whether is there any justification to limit the rights of our people? Is the limitation itself in line with the limitation clause section 86 of the Constitution with regard to the procedure that is being followed right at the beginning? So there were situations where we find that indeed the government or the institutions might have not followed the right processes, but all in all, just we realized that the government indeed was in line with the Constitution section 36. But what was so difficult was the understanding from the community with regard to the understanding of the limitation of rights. Our people were not aware that our rights can also be limited with regard to general application. So which imposed a very serious challenge even to community members to understand those who were supposed to enforce the regulations, such as police, army, and all other government officials. People could not understand. We all know that there were people who could not even understand that they cannot go to the hospital and see their loved ones. We also understand that people were restricted to go to work, and they could not they didn't know what to do because they have to survive, and they could not survive without work. I understood. My colleague also mentioned the issue of the grant, which was not even sufficient. And what was painful is that our people were requested to produce a proof of work. And you will understand that we have so many people in South Africa who are participating informally in our economy, who have a formal employment. So if you ask those people who are selling their items on the robot or on the street to produce the proof that they're indeed going to work or working, then it means that, in other words, you're automatically saying they cannot go to work. So those were some of the challenges that we were facing. But as the Human Rights Commission, we have to now to understand, we had several meetings internally to ascertain whether is it justifiable for the government to limit this rights in terms of the law of general application, or there is any other way that the government could have limit the right or could have deal with the situation, but allowing people to exercise their rights. While our assessment was very clear that it was not easy for the government to take any other road, because in that situation, the government took those decisions to protect life. It must be understood that we were all scared. It was for the very first time since the introduction of the Bill of Human Rights in the country to have such massive restriction or massive limitation of the rights. So we find that the government, in terms of the science, because we must also understand that we might have know much about the law, but the science needs scientists. We need doctors to make us understand the impact. Then as an institution, we were left with no option but to understand that a government has to implement restrictions.
HDMI, but
my apologies, Mr. Mabidura. Colleagues, could you please mute? I'm sorry, Mr. Mabidura. Please go ahead.
No problem. Thank you very much. So we were left with no option but to understand that sometimes we have to
Mr. Mabidura, you are now muted.
Thank you. Yeah, I was saying, since as the Human Rights Commission, we had no other option but to understand that there are certain areas where, for us to execute our human rights properly or to defend human rights properly, we need to also be assisted by science. So there is a proof, or it was proven that by limiting the movement of people from point A to point B, it will limit the spread of the virus, taking into account that there were so many people who were admitted at the hospital, and our system, there was no other way that we can reduce the number of people who are admitted in our hospital going through the normal process. So the movement, the limitation of the right to movement was one of the major problem in the country, because another challenge was with regard to the enforcement. We all know that in that particular district in Membe, people were taken out of their transport, people were arrested, other people were really chased away, chased by the police. So all those challenges, we all know that they were also having a direct impact on human rights. But we were happy that at the end we were able to reduce the scourge of this particular virus. The infection was reduced and all those things. But we are now in a situation where we are facing with another challenge right now. Yes, the government have come up with the issue of with the vaccination processes, and there are so many people who are now approaching the South African Human Rights Commission regarding their rights not to be vaccinated. So as the Human Rights Commission, we are in a discussion. In fact, we have also tried to sought legal opinion on the matter, but we are in discussion internally where we are going to take a position. But our position is very clear. The Human Rights Commission supports vaccination, not a mandatory vaccination. We support vaccination, but we also support that when you want, as an employer, when you want your employees to be vaccinated, if there is no objection, you go for it, it's fine. I think it will protect a lot of life if that is the case. But where there are objections or where there are concerns from other employees, the best way will be to engage with the employees and find a long-lasting solution. We must also understand that it is time that we have to adapt or to adjust ourselves with the new normal. It is not necessary that all the employee, depending on the workplace and the nature of the work that has to be done, other employees can be productive where they are without going to work. So we don't have to be difficult with those and say we are forcing them to be vaccinated. But we have employees, for example, if I can give you an example right now, I'm talking to you, I'm at work, I'm in Cape Town, but I don't need to go to the office to be productive. I can still deliver for the Human Rights Commission while I'm everywhere, wherever I am. But we have other employees who cannot be in the position to work from home, depending on the nature of the job that they are doing or the work that they have to perform. So those are the situations where we feel that there must be that engagement between the employer and the employees so that they can find amicable solution or they can find a solution to resolve the matter. But it must be noted again that we have other people who, because of their health, they cannot be vaccinated. They cannot be vaccinated, and as a result, not by choice, but because of their health, they will have medical proof but only to find that the nature of the job that they have, the work that they have to perform, force them to be traveling or to go to the workplace. So those are the situations that we feel there must be a proper engagement. We don't support any idea or any notion that our people, if you have challenges of being vaccinated, then you must lose your job. I think everyone who's doing that is doing that illegal. And also the government have not even called for mandatory vaccination. But we are also concerned as the Human Rights Commission that we have employers who are now forcing the employees to be vaccinated. Some of them, they are doing it in a manner that is very questionable. They will say, if you are not vaccinated, go and stay home, we'll call you. But they will continue paying salary to those individuals. Some of them, because maybe they were working a shift, you'll find that you are no longer being called to go to work and all those things. Those are some of the tactics that are used. We all know that the employers and the human rights, they don't want to protect human rights, or sometimes it is difficult for them to ensure that they comply with the Constitution or with the Bill of Rights to ensure that our people's rights are always protected. But we always have that particular concern as the Human Rights Commission. And we also have some other institutions of higher learning that also come up with the policies to force students, to force learners to be vaccinated. I don't know, we have not been approached by the student, but some of the policies or some of the proposals have been sent to the Human Rights Commission. We are looking at them if they are really complying. They comply with the Bill of Rights or the Constitution. But the biggest challenge is that as much as we all understand that our people have the rights, we also have to understand that those rights can be limited. But it must be noted that the limitation itself is not just something that an organization will just wake up in the morning and draft a policy and say, I'm going to limit right A or right B. It does not work that way. The Constitution is very clear that the right can only be limited in terms of law of general application. So you do not have, as an employer or as an organization, you do not have the right to limit a certain right because you want it to be convenient to your workplace. You have to comply, you have to respect the Constitution. That's why you find that when we agree with the government, the limitation of the right to the freedom of movement, we agree with the government because they've followed all the steps to make sure that they limit the rights of our people, and it was in line with the Constitution. But when you do it as an individual, or one minister just come up in the morning and introduce a policy that this is a regulation or this is a code of conduct that will limit this right and that right, it will lead this country into a chaos, because everyone will just do as they wish, saying that I want to ensure that my employees are protected and all those things. We all support that employees must be protected, but let us do that in a manner that will not be taking us back where the rights of our people are not respected. So we have that challenge right now. I think the challenge that we are facing right now is worse than the time of pandemic, because everywhere, whenever we are in our offices, we are receiving complaints. It's either from the employees who are being forced, or employees who have been dismissed, or employees who are not being called to work. So many tactics are being used to exclude or to sideline employees who do not want to be vaccinated. And we feel as the Human Rights Commission that that is not the way to go as a country. We need to follow the law. We need to do everything to accommodate employees who cannot be vaccinated. Let us not bring the issue of vaccination, of mandatory vaccination through the back door, because the moment you use other conditions to force somebody to be vaccinated, that is what we call a mandatory vaccination, something that the government have indicated that we are not going to force people to be vaccinated. So as the Human Rights Commission, we believe that the pandemic itself and the aftermath of the pandemic have created a very uncertain situation. We know that many people have lost their job. We had plus or minus 400,000 people who have been arrested during the pandemic, and some of these people are being left with the criminal records. You must understand that there are many people who have paid the fine, And when you pay the fine in a criminal matter, accepting that you were wrong, it means that already you are having a criminal record. So it's also going to affect those people when they are looking for a job or when they're entering job market. So it's not just as simple as it is when you find that more than 500,000 people have been arrested, which means that we have a responsibility, the Human Rights Commission, including all the institutions of higher learning, to engage in a discussion where we can go out to educate our people about their rights, so that when we talk about the limitation of rights, people understand. Most of our people today believe that the rights in the Bill of Rights are absolute. Sometimes they don't even understand why we have to investigate for us to come up with a finding, or why we have to take their information to us as allegations when they are saying my rights has been violated, because they believe that the rights that they have, they are entitled to. They cannot be taken away. And that is where they get affected psychologically when they wake up in the morning with level 5, that they will not be allowed to go to church, that they will not be allowed to gather more than 50 in their funeral, not having party, not having festivals or gigs. All those things, they are happening because our people do not understand that the rights in the Bill of Rights can also be limited. And the only challenge that we have as the Human Rights Commission, we have to look at the manner in which those rights can be limited, and to assess whether the limitation was in line with the Bill of Rights, more especially Section 36 of the Bill of Rights. So we have to do that, but the community members do not understand that. How can it happen? Because I have the right to work. I have the right to go to move wherever I am. I have the right to I've got freedom of association. So our people do not understand that. But I believe that the next generation, or going forward after this pandemic, it was a learning curve that will build us, that will contribute into our society understanding how these rights works. Because without that understanding, that's why other people will end up having depression. Other people will end up having affected psychologically. So those are it's as a consequences of the denial or not understanding that the rights as they are in the Constitution can be limited. I think without any waste of time, I will end there, but there are a lot of challenges, and the Human Rights Commission is really dealing with many cases related to the violation of human rights. Some of those cases have happened during the lockdown level 5. Some of them are now happening because of the vaccination process. So we believe that together we can continue educating our people about their rights and understanding that those rights can be limited, and the danger of not being vaccinated. We also encourage everyone to be vaccinated. We're not supporting mandatory vaccination, but we're encouraging our people to take vaccination serious, because according to what is there, our doctors, Dr. Popira Matuba was saying the same thing here, that our people need to understand that once you are vaccinated, it also reduces the issue of you being admitted at the hospital. It's also it reduces the impact of the virus in your body. So as the human rights activist, I don't think I have any rights to deny that or to say no to that. That is science. It has been proven, and we have to support that. Thank you.
Thank you so much, Mr. Mabidura. Colleagues, we have one more presentation before we move to the questions and answers session. So without any further waste of time, let me invite Mrs. Langi Madamba, South African Council for Social Service Professions Registrar. Mrs. Madamba, over to you.
Good afternoon, Program Director. It seems as Mrs. Malamba is struggling to join the meeting. She mentioned the issue of load shedding. So let's give her just a few minutes and then we'll take it from there.
Okay, thank you.
Good morning, Chairperson. I've managed to log back in, but I'm hoping that my Wi-Fi would hold. It's very poor. So yeah, I'm back in the meeting.
Okay, thank you. You are very audible. Please proceed with the presentation.
Thank you, sir. I'm not sure if the admin person is going to assist with sharing the presentation or if I can be given sharing rights. Tabisa?
You can share registrar. If you can't, then I'll chip in.
Okay, let me see that. Okay, I'm just trying on my side to upload the document. Okay, please tell me if it's showing.
Yes, it's showing.
Okay, thank you so much. Maybe just to briefly, I'm not sure if I can reveal my face just for those people who do not know me. Is it showing?
Yes.
Yes, we can see you.
Yes, we can see you.
Thank you so much. All right, it's not showing on my side, but nonetheless, it's a privilege for me really to be part of this very important webinar. I want to start first by just sharing the vision that the South African Council for Social Service Professions has, which is to see the social service practitioners united in excellence, and not just excellence, but service excellence and high standards of service provision. And how Council envisions achieving that vision is to serve the best interests of the social service practitioners, the professions, and the service users by regulating, leading and promoting the social service professions in an innovative and responsive manner. Ladies and gentlemen, I want to just share part of what I'm going to be saying has already been touched on by many other speakers. And I want to just, reflect on what my life was like before March 2020. For me and most of the people in my neighborhood, life was very normal. I was a bear hugger. I still am, and I'm yearning for a moment where I'll be able to still, enjoy giving hugs to my kids or receiving hugs when I'm feeling down. And I perceived South Africa to be safe from the pandemic. And I also looked at it as an overseas problem. It was far away from us. And, at some point it was classified as a disease for people who were traveling overseas. And I thought, if I'm not, traveling, or I'm limiting my traveling, especially overseas, I am okay. By the time the COVID comes to South Africa, I was hopeful that our local scientists would have figured out how to keep all of us safe. During the pandemonium, I started over-focusing on providing essential care services to vulnerable people. And as registrar for the council, I looked for opportunities, or ways in which I could unlock opportunities to make sure that our social service practitioners continue to render essential services. That in itself was very stressful because I had to knock on so many doors to make sure that we can get the essential PPE distributed around the country, make sure that all our, especially NGOs, those people who were, continuously complaining about the lack of services, lack of funding, to be able to procure, your sanitizers, masks, and any other PPE, will be afforded an opportunity to receive such. And as a responsive council, we continued to do the mobilization, spoke to other stakeholders who had latent cash or funds available to make sure that we can unlock opportunities for training to empower our, social workers, child and youth care workers, social auxiliary workers, to be able to understand the complexities that the pandemic brought with. Awareness raising dialogues to bring the reality of COVID closer to people who did not believe it exists. I did a lot of that in my neighborhood, especially, ordinary people who most of the time heard only, untruths about what COVID was about, whether it was government trying to instill fear in us, whether it was a white man's disease, and the many stories that were permeating our social media spaces. I did a lot of role modeling to my family, to colleagues and friends to observe protocols. Most of the time during the pandemic, I believed that I was safe because I was doing exactly what was being, preached to be the way to deal with it and to keep it at bay. With time, I started to experience withdrawal and loneliness because I was not able to cuddle. And I was staying home and I was working home and I was doing everything at home. There was just general isolation around me. And like, I think it was Dr. Bila who mentioned that sometimes she would sleep at 2 a.m. I did a lot of abnormal things, whilst trying to normalize living with COVID in our spaces. I found myself pressured most of the time. 8 hours was never enough to do my work. After the first, the second, and during the third wave, I lived in fear. I was preoccupied with death and dying because everywhere, if it's on TV, if it's newspapers, all you saw was people dying. The statistics was getting higher and higher by the day, and I was starting to dread even watching TV. I was overcautious to adhere to protocols and to make sure that I over-sanitize. I clean the high contact areas in my household and make sure when the kids come back from school, they sanitize. They don't come anywhere close to me because I also saw them as potential spreaders, So it was a very weird situation. And I'm thinking whatever I was going through, other people in my community are also experiencing that. I became an accidental recluse. I had fear to visit, whether it's the mall. I hardly ever left my house unless it was absolutely necessary. And on a few occasions where I had to leave the home was when I was going to hospital. And it was a very scary moment because I would go to hospital alone. I will go through all the checks, go through all those designated colors that you start the tri-aging, you start here, you go here. I will be unaccompanied. And all I would see around me was fear because everybody had to space and nobody was speaking to anybody. And we all sitting there locked in our own thoughts, fears, and experiences. As time went on, I had lots of guilt feelings, which stemmed largely from the lack of closure on many, levels. I couldn't attend funerals of family, very close family members. My uncles who raised me, I couldn't. And I expected and I hoped to this day that I'm forgiven for not being able to attend those funerals because only very, very, very key people, the elders in the family would go. And I would sit feeling very guilty that maybe I should go because I'm younger. I might be able to leave it off than my mom who's 84 and so on. The guilt of not visiting my elderly mom, the guilt of not going to church or, being part of the community when there were issues, funerals down the road, I couldn't go. So I also developed comorbidities during this period. Maybe they were always there, but they become heightened because at some point I had to be hospitalized. And for the first time I heard the word hypertension, I freaked out. And I was told you have cholesterol, and I regarded myself as a health fanatic. I eat healthily. But all of these things happened. And I guess it was because of the heightened stress that I was living under. Suddenly, one day I woke up with 3 members of my family, including myself, COVID positive. And I only had one child who was asthmatic, who was not, positive. And that put immense pressure on me because what played out in my mind was, what if we all die? Will my son cope? He to me, he's a weakling because I look at him emotionally and I'm thinking, sure, how do we keep him sane? Because he's surrounded by people who are sick and we're trying to protect him from getting infected as well. So it's the elder brother, it's my husband, it's myself and the daughter. But in this whole milieu of everybody getting sick, I had to be the carer. And that put extra, pain and suffering on me, because at night I would walk over, check everybody's breathing, put the oximeter on their fingers and check everything. I was obsessed with making sure that everybody gets well. And in the process, I delayed my own healing. But later on, I started to reconnect with my body signs. I started to appreciate my breathing patterns and to listen to my body and to listen to my heartbeat and to measure the blood pressure to check that my pressure is okay, check the blood sugar levels in the morning and so forth. And that somehow helped me in a way, but it also made me sick because I think I overthought things. And I did a lot of research. I don't know how many sites I visited, how many doctors I listened to, and tried to see that I'm, keeping with the trends. Long-term effects of all of this is I suffered long COVID effects. I was grossly fatigued. My whole body was weak because I stayed almost 2 months in bed, but fighting it off. I wanted to do lots of exercises, but my body couldn't take it. I struggled with breathing, but thanks to God and my ancestors, I didn't go to hospital. I developed PTSD. I was afraid of sleeping. I was afraid of just being alone because I felt like, what if something happens? I had fear to be reinfected. And then the vaccination came closer to me when my husband was first vaccinated, and I thought, will I also have an opportunity to get vaccinated? Then I had to wait 30 days and I was watching him. He had his second dose and I was still not strong enough to go. And I had to then, contend with just the internal debate that I had to have every day. If I'm not strong enough, how long am I going to wait till I can go and test out that I can, have the vaccination and I won't have any complications? And then just before I had my first vaccination shot, a colleague called and was saying, oh, so-and-so in the family died. And that really put me on the bed in a bad space, because then I became more worried and my blood pressure went up. And I thought, I'm not going to allow this to hold me back. If I have to die, I'll have to die. But it was a scary moment. And having to walk again through those long queues to where you wait and you see just, this hall full of people, and we all seated there and you wait your turn, they do the preliminary screening, and then you have to go meet these people who are clad in all those clothes. And, eventually it wasn't as scary as I thought. And I think what was making me very apprehensive was just all the things that I was hearing. Ready as I was emotionally, I think when I got there, and eventually they gave me the shot, and I had to go and sit out the 30 minutes because they said, you've got comorbidities, we would want to observe you. And then I started worrying, and I think it's the thoughts that just makes you get more sick from just overthinking. But eventually I had to challenge myself on many levels, spiritually, emotionally, physically. I had to start making my body want to exercise because I had lost the strength to do anything. And I had to fight the irrational thoughts and the fears and remember to live one day at a time. And to believe that, with the science that is around us and people who have access to resources dying and all of that, it is not about what you have. It is about you just connecting with where you are and being able to embrace that moment and know that when it is time, it is time. You can't do anything. You can't buy time. You cannot, try to be in the queue and say, no, God, please leave me for another month and so on. All these things to me are predestined, and therefore I should stop worrying about it and just live for the moment and do what I can, which I have control over. And that is how I stopped reading too much on COVID. What after, if you have done this, you must do that. I avoided the news updates because I just felt like it is making me more sick. What helped me to cope? I focused on work and finalizing my MBA. And I had a mantra where I was just praying novenas for healing and doing it anytime I started to feel panicky. I started doing a rosary or doing my novena. Played a lot of music for relaxation, worked in the garden, herbal infusions, and did a lot of breathing exercises. It just helped to calm me down. I have, of course, support from a whole number of people. My family, I've got siblings who are doctors and nurses, and they will check in with me every day. I had a neurosurgeon who was very caring, and a cardiologist who checked on my heart, and my GP. And I had other herbalists and traditional healers who I would also touch base with. Reading the latest trends and monitoring my own post-COVID symptoms also helped me to cope, because it normalized some of what I was experiencing. And also seeing the benefits of what was happening with COVID vaccination around me also helped me to know that there is hope. What do we need? I think there's a need for a humanitarian response, taking into account indigenous cultural practices and knowledge systems. There's a need for cogent social research into the impact of COVID on the students, on the social service profession workforce, or the workforce in general, and households. I think in the milieu of everything that we're doing, the mental health of our students and other essential workers is of paramount importance. And we also have to focus on households, because a lot of social dysfunction has happened over the 2 years. The health and wellness programs to empower frontline workers to cope and to continue to render essential services are needed more now than ever. Support services for carers. I felt it when I was caring for my family that the burden is just so insurmountable. And if we don't look after the carers, we run the risk of losing them. And I saw myself having to start to become selfish, to be kind to my family by starting to focus more on myself, looking out if I need a massage, or doing things to just help me feel better, holistically. We need integrated COVID response plan with mitigation strategies in lieu of imminent risks of a resurgence of spikes in the infections, especially now with the speculations whether the elections have predisposed people to another fourth wave or fifth wave. We need to be able to come with a particular response which will be able to deal with a whole lot of risks which could emerge, especially now that we're going towards the festives. We need a solution-focused approach to curb the undiagnosed high levels of poor mental health. I had the privilege of understanding mental health issues that I was grappling with. What more about ordinary members of the community? And I feel a lot of people are sitting with undiagnosed issues. A lot of people who have been retrenched because of COVID challenges are sitting with a lot of depression, a lot of anger, a lot of, undealt with issues. And therefore, we need a solution-focused approach to curb, a whole lot of those issues. We need programs to restore optimum functioning of communities and our stakeholders post the COVID mayhem. We need awareness interventions to contribute to empowering people to cope with everyday challenges and demands. We need social responsibility outreach programs, which would help people to cope. And to my colleagues in the schools of social work or the humanities faculty, we need to look at what is the state of the community's mental health since the first wave. What happened to the children who overnight lost parents or seniors in the households? Is there a role that universities can play in contributing to household profiling to get accurate statistics on child-headed households out there? The Gogo and Mkulu-headed households where the whole family has been wiped out because the kids have been having a good time and going to parties and all of that, and they all died due to COVID. Women-headed households and the impact on women who are caring for other people, poverty levels, the state of apathy, etc. Is there a chance that universities could assist with resource mapping analysis to assist the Department of Social Development and Health and any other department, key departments, to look at ways of mitigating following the president's announcement for a district development model? Is there a way that universities can play an integral role in making sure that we map, what are the resources, where are the gaps, areas of needs, etc. There is also a need for the schools of social work to ponder on psychosocial support services to essential care workers, especially the mortuary staff in private and public. And I'm glad the MEC did mention that there is focus or some support that has been given. You know, we need to help these people to lead normal lives because they have been overexposed and they've been expected to carry on doing what they have to do without debriefing before they go home. They would have seen so many deaths in 1 hour and they would have to carry on as normal and go home, be able to eat a meal, be able to be loving to their wives and to their kids. Now, in closing, I want to say to my colleagues, perhaps what needs to be done is to prepare our students to be agile enough and to help them to connect with their practice universe and help them to be able to transcend the emerging issues and develop an innovative response, taking into account the context within which they do their practical work, look at the risk factors and even protective factors which are also contributing to the problems that we're dealing with, and also to explore suitable interventions. The universities or schools of humanity and schools of social work needs to look at mitigation strategies for other pandemics as well, because whilst we've over-focused on the COVID-19 pandemic, there are other social ills and other pandemics which continue to ravage our communities. Poverty of the mind, there's just general ignorance in communities, which is very sad, because if people are ignorant, they are gullible to listen and believe anything that they see, read about, or hear on Facebook or wherever they are exposed. There's general poverty levels in our communities, food scarcity, gender-based violence, especially intimate partner violence. And we've seen a rise in gender-based violence, incidents in our academic institutions, which is very worrying. We've seen the issues related to bullying, becoming a norm in our schools. HIV and AIDS continue to be, another pandemic that we need to focus on. Mental health issues in general needs special focus because we have ticking time bombs waiting to explode in our communities. Issues around retrenchments, are also creating a situation which requires serious attention to make sure that people are helped to cope, families are enabled to continue living. Chairperson and members of this webinar, thank you so much for listening.
Thank you so much, Mrs. Malamba, the Registrar, South African Council for Social Service Professions. Colleagues, that was the last presentation, and I had consistently been saying that provision has been made for questions and answers session, and 30 minutes has been set aside for that session, and it's around 12:30 now, and I'm sure by 1 o'clock we'll be done with this session. So I'm now going to hand over to Dr. Jimmy Budeli, who is a lecturer in the Department of Social Work, University of Venda, to facilitate this session for questions and answers. Dr. Budeli, over to you.
Thank you so much, Program Director, Dr. Zaga, for allowing me this opportunity to facilitate the question and answer session. Before I do that, Program Director, allow me to send my sincere appreciations to the Vice Chancellor and Principal, Dr. Ntameleni, and our Honorable MEC, Dr. Popira Matuba, and our guest speakers from all other universities in the country. My first impression of the first speaker, and taking from what you have indicated, your first comment was that the first presenter has made a very thought-provoking presentation. And my understanding is that when people are provoked, they are more likely to ask questions and which need answers from our speakers. Allow me to take this opportunity to ask all our attendees here to use our chat box space. If there are any questions or if they want to raise their hand, they can raise up their hand. They will be noted and be given an opportunity to ask those questions to our speakers. Thank you so much. It's open to the floor to ask those questions or to make any comment. The session is open to the floor to ask questions or to make any comment. Program Director, it appears for now there are no questions or comment. Okay, I see. Can somebody help me to note? I see the hand there, but from my side, I don't see who the person is. Can the people from IT maybe assist me to? Yeah, Manasseh Hlungwane, I see your hand is up. Manasseh Hlungwane, your hand is up. You can unmute yourself and pose a question or a comment.
Good afternoon, our honorable speakers and my fellow students. I'm Hlungwane Manasseh. I have a concern. I feel like there's a lot of limitations of rights and inequality when it comes to student social workers, whereby we're supposed to do our practicals on second level and third level, as well as fourth level, which is final year. I understand when we didn't go for practicals last year as a second level student, just because everything happened so quickly. But as for this year, I felt like, I don't know, it's school management or the country as a whole took social work practitioners as less practitioners. Why? The reason why I say so, some of the students went for the practicals, like for instance the educations and the medical practitioners. Hence, I think our services is much more important at this level, just because life there need our services. This question goes to, okay, before I suggest that in future, try to make some strategies where you can accommodate us. Like for instance, as far as I know, a second year student of social work supposed to go for practicals once a week, where maybe you can squeeze, maybe this week the first group will go for practicals, the second group will go for whatever strategies we'll make. So the question goes to University of Venda and its management. Why some of the students went to practicals, but the social workers not recommended to do their practicals for second level and third level? Because I think our profession is very much important. Because at the end of the day, I'm going to do my final year maybe next year, and I will do a lot of mistakes just because the theory will be much than practicals. So that was my question. Thank you.
Thank you so much, Manasseh Hlungwane, for posing that question, a concern. I want to believe that the head of Department of Social Work, Dr. Mkorosi, has heard that. Your response to that, Dr. Mkorosi?
Yes, good afternoon to our students, Manasseh and Dr. Budeli. I thought the best person to address that question was going to be Dr. Mangani, because that question is more like in-house question rather than this. But also she mentioned that this category of people were in this category certain things happen not because by plan we wish to have done certain things, but if they didn't happen, it was not unnecessarily to disadvantage our students. So if she wouldn't know, but staff members, if you remember that we had to sit down and say, in the place of doing this, what can our second year do? In the place of that, what can our third year class do? Fourth year, this, you know, as it goes down, as it goes up or down. That is not a good answer to our students, but certain things were done in the place of them not getting a chance to go out. So one of the reasons why we're having this panel to say what has happened and what can be done. Also, perhaps maybe our registrar, without putting under a bus, maybe she can comment about from her angle there. I don't know, Mr. Abdeli and Ms. Malang.
Okay, thank you so much, Dr. Mkurose. I see Dr. Manganyi's hand is up. She also want to assist. Dr. Manganyi.
Yeah, thanks, Dr. Budeli. I just want to say to our students, it's not like we take them for granted or our profession less important. As the HOD indicated that, you know, some circumstances forced us to decide and to come with other options or will modalities that we had to practice or use for this year. And saying that, we just had a meeting with Limpopo DSD last week. So we are still experiencing a challenge. Yes, students want to go out there, but due to COVID-19, some offices were closed. They are not functioning anymore, and they are working on rotation or percentage that today this one is coming. So, I mean, they were also emphasizing that if we have to come with some strategies that our student social workers doesn't have to find themselves in their offices, because you find one office packed with 3 or 4 social workers and we are bringing our students. So this is a predicament that we find ourselves in, but believing that the options that we came with, they were able to assist or part knowledge when it comes to fieldwork practice. Thank you, Dr. Budeli.
Yeah, thank you so much, Dr. Manganyi. I hope the student is answered. Thank you so much. Yeah, are there any questions or comment? Okay, thank you so much. The registrar, I see your hand is up.
Thank you, Chair. I think just to reiterate to my students that the important appreciation that they need to have now is the efforts that the institution is taking to create a blended approach, and to remember that with practicums or their work integrated learning, it really depends on availability of the placement partners. So the fact that they have to do placement elsewhere, whether it's in the school setting, whether it's within Department of Social Development or any other department where they would be supervised, it is important that they understand those complexities, that, you know, the coordinator, the student placement coordinators must work with a willing placement partner. And if lots of people, remember, COVID presented an opportunity where lots of people can work more productively from home than to be in the office, because at times we spend a lot of time in traffic before you get to the office, and when you have to go home, you spend another 2 hours. So the opportunities created by this new normal way of working, in a way, has also created a problem. Now, what we need to explore possibly with my colleagues in the School of Social Work is whether in situations where people are working mostly remotely, you know, working from home, is it possible to start exploring virtual ways of, you know, conducting some of the possible things that can be done, where a person can be shadowed and then they have case conferencing virtually, and then they do sort of things, you know. For example, you can say to Manasseh, go and observe at the clinic this and this and this, and then have a way in which you engage with your supervisor virtually to discuss and to make sure that you're doing things right. So it shouldn't be impossible to introduce another way of doing work integrated learning and make sure that there's enough support and supervision, created for our students. But it requires a lot of innovative thinking out of the box to make sure that we don't expose our students to unsafe environments where they might do things which are maybe not ethical. So it requires more engagements within the School of Social Work to look at possible ways that it can be done, and also engage with the students to hear what are they willing and what is within their available means for them to be able to conduct practicals, because you can still conduct and have a cluster supervisor who will be available and willing to supervise them as they go on site. And depending on the level of study and how much time they need to be on site, you need to look at all the different variables. Thanks, Chair.
Thank you so much, Registrar. Yeah, I'm checking on my screen here if there is any hand up. There is nothing on the chat box. There is nothing as well. Okay, colleagues, is there any burning issue that you would want to raise to? Okay, I see Takalani Mbedzi.
Thank you, Program Director, and good afternoon, everyone. I just wanted to ask a question with regard to the staffing of the mental health care practitioners. I'm working here as a clinical instructor. I usually go to the hospital accompanying the nursing student for work integrated learning. What I have observed is in the hospital there, as it was indicated that the COVID has negatively affected the mental health of our society. So as it was also said that we do have some healthcare facilities, the institutions where these people can be attended to. But normally what I've observed is that we've got a severe shortage of mental health care practitioners out there. So maybe I just wanted to ask if maybe there is a provision for creation of posts, and also that you look that some of the healthcare frontliners, were affected. We have lost some of them, maybe like a reasonable number. So maybe from the MEC, is there any provision for for creation of a post for the mental health care practitioners? I mean, the psychiatric nurses, the doctors, the psychologists, and the occupational therapists, because I think that the ones who are supposed to address these mental health issues, as you have indicated. That's my question.
Over to you, MEC. Honorable MEC Ramatuba, I think the question is directed to you.
Good afternoon again. I'm not the MEC, but I think the MEC indicated earlier that she has a commitment at 11. So I would like to believe that she has left the platform.
Okay, thank you so much, Dr. Matse, for that. Yeah, unfortunately, Botakalani, your question might not get an answer because of that absence of the MEC.
Okay, noted.
Thank you.
Okay.
Thank you so much. Yeah. From the floor, are there any questions or comment? Yeah, from our IT section or media personnel, is there anything that you are seeing on your site, whether it's a comment or questions? Okay, it appears there's nothing. Program Director, from my side, I don't see any hand or comment or in our chat box. Thank you so much, and over to you.
Thank you so much, Dr. Budeli, for handling this item. And we are now getting towards the end of our webinar. And let me take this opportunity and invite our Deputy Vice Chancellor, Teaching and Learning, Professor Ian Crawford, to have some closing remarks and vote of thanks. Professor Crawford, over.
Thank you very much, Program Director. Our Vice Chancellor, Dr. Bernard Mtameleni, and colleagues from Univen, our Honorable MEC, Dr. Poppy Ramatuba, and all our visitors from other institutions. Let me start off by thanking our Vice Chancellor for taking time off what is a very, very busy schedule this time of year to be with us at this webinar. We thank you, VC, also for that excellent introduction to our MEC, to our DVC Research and Postgraduate Studies, Professor Feza. Thank you very much, Prof, for pulling out all the stops in spite of some challenges to also be with us and to attend this webinar. To our Executive Dean of the Faculty of Humanities, Social Sciences and Education, Professor Bantwini. Prof, thank you very much to you and your faculty for hosting this excellent webinar on an extremely topical subject, which is the impact of COVID on our lives. And I think it has served its purpose to illustrate to us the various impacts that this pandemic has had and continues to have on the lives of our people. Then to Dr. Mohorosi, Head of the Department of Social Work, thank you very much also for introducing our guest speakers and for your continued leadership in that crucial department of social work at our university. Then to our first guest speaker, Dr. Nontembeko Bila. Dr. Bila, I think your presentation truly resonated with all of us as academics and as students. I think the big takeaway from your presentation is that we need to rethink the nature of support to both students and staff, and that we need to place particular emphasis now on psychosocial support to supplement the academic and financial support that we give to our students. Then Ms. Zambia Lorraine Bam, I think your presentation on how the pandemic has in particular impacted persons with disabilities was eye-opening. Your example of an autistic person who was suddenly denied the right just to go for a walk really resonated. It showed those hidden impacts that we were not even aware of or did not even take account of that we need to address going forward. Then Professor Puleng Sekalo, you pointed out very clearly to us what we know and suspect, and that is that the pandemic has not only accentuated but also deepened inequalities, not just within our country but internationally. Also that the digital divide has had a particular impact now in terms of technological access or the lack thereof by parts of society, when this has become crucial for navigating the pandemic and its impacts. Then, Mr. Victor Mavidula, you have introduced us to the work that the Human Rights Commission in Limpopo has been involved with, and you explained to us the difficulty sometimes of balancing the rights of people with the rights of government to limit those rights under particular circumstances. And we thank you for sketching that background. Mrs. Langi Malamba, Registrar of the SAC-SSP, I think the fact that you illustrated the community mental health impact by using yourself and giving us such a very personal experience was an excellent way of illustrating just exactly how severe the impact of this pandemic was on individuals. And we thank you for sharing a very, very personal story with us. Then Dr. Jimmy Budeli, thank you for facilitating the brief open discussion. Thank you to everybody who attended and participated. Dr. Takalani Zaga, our program director, as always, you handled the proceedings with great aplomb, and we thank you and your team and your technical team especially for making the webinar a success. And with that, thank you very much, colleagues and guests, for your attendance, and back to you, Dr. Zaga.
Thank you so much, Professor Crawford, and once again, thank you, colleagues, for your participation. And this brings us to the end of our webinar, and enjoy your lunch. Thank you so much.
Thank you very much.
Thank you so much.
Thank you.
Thank you, everybody.
Where are we going for lunch?
It will be posted by email.
It's fixing.
Thank you.
No announcement.
Sislangi, Dankine, and the panel and everyone.